I wanted to give a shout out to my doctor today, Dr. Voss, because I went in for something that isn't exactly treatable. I have heart issues. Let me just explain. I have panic attacks that lead me to have heart pains and chest pains that can get intense, and I've had them for 4 years following domestic violence. However, in the last year, they've been more fuller. In the last 4 months, it's been more intense. It's been at times that aren't even connected to panic attacks, and it's been connected to arm pain, which can be, as you know, like very closely related to heart attack symptoms. So it's definitely worth getting checked out, and I probably should have went sooner. All that said, sometimes domestic violence survivors like myself have a series of symptoms that are all very similar. Sometimes it's adrenal failure, sometimes it's IBS, sometimes it's kidney failure. There are things that are happening that can't exactly be explained why. And because it can't be explained, a lot of times victims or survivors or anyone will go in and say, hey, I'm having heart pains. And a doctor will say, there's nothing wrong with your heart. It's all in your head. There's nothing wrong with you. Earlier this year, January, February, March-ish, can't remember the time frame, I had to call an ambulance to come here because my daughter was sleeping, my young daughter was sleeping. I was having chest pains that were pretty intense, but I also felt like there was like a dumbbell sitting on my chest. It was the first time I'd ever had a very hard time breathing. It was, you know, like that, and chest pains, and so I was pretty scared. And I was like, I do not want to die in my bed tonight and have somebody say, why didn't she just call the hospital? Like, why didn't she just get help? So this last week, they were pretty intense. I was like, I'm just going to make an appointment. So I made an appointment, had it this morning. She gave me an EKG, and she said, you know, you're not showing any signs of tachycardia, no AFib, no palpitations right now. She said I wasn't showing any signs of stroke or heart attack. So she said, that I can see, there's nothing wrong with your heart. And I was getting a little teary because I knew that right then she was going to be like, so there's nothing wrong with you, you know, here's some more Xanax, here's some more, you know, Zoloft, whatever. But she didn't just push medications on me. What she actually said was, I believe that your pain is real, but I believe that is related to trauma, and it's closely related obviously to panic attack and stress. So let's talk through things that you can do to reduce your stress, which was totally fine. But I already do all of those things. Everything that everyone suggests you should do to reduce stress, I already do. I already meditate. I'm already pretty active. I already eat pretty healthy. I have talk therapy. I also have a loving group of supportive friends. So there's some of the core things to reduce stress I already do. But in addition to that, there are some things that we're going to make some medication different. But I was so appreciative because she said, it seems like this is very related to trauma and your heart is trying to tell you something. And that's why I was crying, because I felt like, yeah, my heart is protesting. I think my heart is letting me know, like, you're in a significant amount of pain. But I was like, I'm already trying to do so many things to address that. And it's like every time my heart is telling me, like, you're in pain, I'm acknowledging, yes, heart, I know there's pain. I know there's trauma. I know there's been significant recent trauma. Well, at least in the last year and a half, I was assaulted. That was a very traumatic event. My mom died. That wasn't traumatic, but it certainly is grief. I'm definitely grieving. And I'm still dealing with complex PTSD as a survivor of domestic violence. But she said, no, I think it's more of your severe childhood trauma, and that exists at a subconscious level. And when trauma exists at a subconscious level, you cannot just heal it through normal talk therapy and normal healing modalities. It takes more. So she asked about accessibility to those things. I have done EMDR therapy before, which is a more intense way of healing and unearthing trauma that needs to be dealt with. I actually believe EMDR therapy saved my life. I think I may have unalived myself if I hadn't gone through that. I did that specifically to deal with the domestic violence I had recently gone through at that time. And I have never done EMDR therapy to unearth the damage caused by surviving a decade of sexual assault as a child, and the kind of neglect I experienced by being raised by a schizophrenic. That's where my childhood trauma comes from. And I think what she was trying to say is like, your heart pains are probably not going to go away until that stuff is addressed and that stuff exists on a subconscious level. I feel like it's God's gift to me, because I understood all that stuff before I saw her, but I've never had a doctor be brave enough to say that out loud. or even to even interact with a doctor. I'm just very thankful for being heard, for being believed, for her saying your heart pain is real, for her acknowledging, like, I believe that you experience real pain, that it's scary, for her letting me know, like, you have, for validating me, like, you've been through this trauma is having a severe effect on your body, your heart is trying to tell you something. I feel like a lot of doctors don't say that. I don't know if they're not allowed to, but I think we all know now, there's enough research, there's enough books, like, we all know now that our bodies, a lot of our bodies are breaking down as we get older with stuff we don't even have to deal with because of emotional and psychological pain. Like, there's so many more studies that have come out recently, but it's not like, doctors are not trained in this in medical school. At least, like, 2 of my friends are doctors and they have told me that too. Like, we're not trained to talk about this. We are not supposed to be telling people, like, oh yeah, you got psychological issues in your past that are causing your present day IBS, your present day neck pain, your present day shoulder pain. They're just supposed to, so yeah, they're just supposed to push surgeries and push drugs. And I'm just grateful, very, very grateful that, yes, she helped me to understand, like, here's how Xanax can help you. And I had already had Xanax. I just use it very, very, very sparingly. But I'm thankful that she also presented different alternatives. So I don't know, this is just my reminder, number 1, that there are good doctors out there, but number 2, that things that seem inexplicable that happen to us in our body, it's not always explained with doctor's visits, because they want to find a reason, and sometimes the reason is pain. And I've been looking more into, I'm reading a book right now called Cured. It's about spontaneous healing. I'm also a big fan of Dr. Joe Dispenza and how we can heal our bodies with the power of thought, which is something he did. He is a miraculous story. You should hear it. So I'm interested in that. I'm interested in all paths that can help.